Afternoon, everyone. Thank you for coming today. I hope I can answer some of the questions that you may have about the urinary system, especially as we are aging. We will all experience some kind of issue, but it's okay. We will run through it and we see whether we can answer any other questions that come along the way, okay? For the interest of time, of course, we can't discuss everything, but I'm just going to talk about what is the most common things that you may face as we all age. Okay, what is incontinence? Incontinence, right, basically just means that you cannot control your urine. It will come out by itself. Okay, that's the general, easy to understand kind of explanation. It's quite common, but it is not normal. Okay, among Asians, right, that's among us, about 15% of people will have. And what it does is that it affects us socially. You cannot go out. Sometimes at work, you also find it very disturbing because you keep wanting to go toilet or you keep leaking out for the ladies. Okay, domestically, physical, sexual, and of course psychological. Because you're so disturbed by the urination, right, that you cannot function, you know. Got patients who really cannot do anything because of the urinary system. Yeah. So in the survey in the Angmos, right, in the Western countries, right, up to almost 70% of women, right, experience some form of leakage of urine, no? But only 30% found it a problem. The reason is because a lot of people think that it's normal, you know, as you age, but really, some people really do not leak. If you leak, right, there's some inherent issue that we need to resolve. Okay, so ICS, right, is a society that defines all these medical conditions in the urinary system and leakage. So the definition of incontinence is involuntary leakage, which means that you like it or not, it will come out. Okay, and it may or may not have urgency before that. So some people, I leak already, then the next moment they found the underwear wet already. Most people will have some form of urgency. You got some sensation at least. Okay, so what is urgency? Urgency is a sudden need to pass urine, no? Cannot tahan one. Need to go. You go and rush to find the toilet or you leak already. Okay? Then some people have mixed urinary incontinence. Okay, so basically mixed just means tapalang, everything together. Other than the urge, some people got stress. You look at it, right? The SUI, right, means stress incontinence. Stress means every time you cough, you sneeze, or you suddenly stand up from a sitting position, you leak. Okay, that one is a totally different thing. Okay, although they seem similar, but later I'll explain to you what's the difference. Mixed, right, is the most common among the females. Almost half are mixed. Okay, urge, right, is almost 21%. Urge means you cannot tahan. Need to go means need to go. You not leak. Stress is whatever I told you, the cough and sneeze kind. Okay. Okay, so this picture I think makes it easier to explain. Stress, right, happens when there's an increase in abdominal pressure. When you suddenly cough, then your tummy will cramp a bit, then you leak out. Okay, most of the time it's caused by weak pelvic floor muscle. Pelvic floor muscle is a muscle that you can train and can control. It's different. Okay, from say urge incontinence. Urge incontinence is what I told you just now. Suddenly the urge comes. Then before you know it, you already want to leak already. Okay, most of the problem for urge lies in the bladder. For the guys, of course, there's also prostate issues. It's a different thing altogether. So that's the difference between stress and urge. Overflow is also different. Overflow, some patients, they have inherent issues that they don't know. So they feel that it's leakage. You know, they can't tell me, hey, actually I leak a lot. I leak non-stop. Then you cannot be leaking non-stop. There's always some form of control. But because, right, something doesn't work well, so the bladder cannot contract and the urine is still stored inside the bladder, but they don't know. So before you know it, the urine comes out already. So overflow is something like, imagine a cup, but when you keep pouring water into it, right, the excess will all leak out. So that's overflow. Because the cup or whatever, the balloon cannot contract properly. So that's overflow. No? But a lot of people perceive it as some other form of incontinence. So we need to check it out. It's similar yet different. Okay? So a lot of things can cause it. Number one, hormone deficiency. For hormone deficiency, I think it affects the females more. After menopause, right, the whole private part also changes. It becomes more dry. The system not so good as last time when we were young. So that's one of the reasons. Okay, urinary tract infection. Some people got UTI, they painful urine, all this, and suddenly cannot control. But at least this one can resolve. Constipation, it gets more common as one ages. But there are a lot of young ladies who have constipation also. So when they are so badly constipated, right, they actually go into retention, you know. As in they cannot poop and they cannot pee. So sometimes they cannot pee, they thought it's incontinence. It's not. Basically, it's all overflow incontinence. So we need to resolve that. Okay? For the guys, right, the prostate enlarges as they get older. Okay, no choice. It's part of aging. And when the prostate gets really big, right, they actually block the urine from coming out. So as time goes by, the bladder gets affected too. Then post-urological surgeries, that's for us. After we have done surgeries for patients, for example, for rectal cancer, for bladder cancer, for all other prostate cancer, then after that, they got leakage of urine. After delivery for the ladies, okay, after they give birth, everybody will experience some form of incontinence. Usually it resolves, but some people it's permanent. Okay, pregnancy, childbirth, as you know, menopause. And then neurological conditions. Some patients, they have some stroke, or they got some spinal conditions, like just now what Dr. Fong has gone through. Sometimes they do present with incontinence, That's when we know there's something wrong. The spine has issues. Okay, so who are at risk? Females are usually generally more at risk than guys. Okay, then as we get older, we become fatter. Then some people smoke, then they cough, then they leak. Okay, then all of us love our kopi and teh, right? So they drink and drink and drink. Chinese tea also, okay? Drink until they got a lot of urgency. Okay, some people take some alcohol. Then as they get older, they realize that they cannot hold so well already, so also cannot. Okay, diabetes, Parkinson's, spinal issues, and all the surgeries that we went through. Okay, so every time they don't know what kind of incontinence, they'll tell me, oh, I feel my bladder very active, overactive. So the overactive patients will feel like, they're going to leak. Most of the time they don't, because they rush to the toilet in time already. Then they always feel very kanchong. Then it actually affects them. Most of the time it's transient if you get it treated, but it can be permanent if the bladder has some issues. But all in all, it's usually quite curable. Okay? Yes, so overactive bladder, the causes, female more common, the Western population more common. You have neurological condition like stroke, Parkinson, also make it more common. Aging, of course, is for everybody. Okay? Okay, stress. Stress is what we went through. When you cough, you sneeze, you leak. Then sometimes, right, when they suddenly run or suddenly want to chase after the bus, also leak. Then squatting down, also leak. That's when there's an issue. Most of the time, it's really a few drops. But sometimes they wet the pants off. So most of the time, the patients will wear black pants. And some people do wear diapers or this. But I think if you get it treated, then it's unnecessary. Because we all wear diapers when we are very, very old. So don't do it when you're young. When you're younger. Yeah. Okay? So stress incontinence, why is the pelvic floor problematic? Usually when there's some damage to the pelvic floor muscle or nerve, for example, during delivery, when the kid is really very big, right? The head press onto the muscle, or they tear it, or the nerve cannot compress. That's when the post-delivery ladies get problem. Okay? Then as you get older, menopausal, the tissue support, all this also not so good. Okay? Then the rest are all whatever you went through already. And other things that are very, very reversible are obesity. And then some people have chronic cough. After COVID, a lot of people coughing away, Then I realized a lot of people were leaking away. Then after the cough settled down, more or less it settles down. Not so bad. Constipation, very common. Try to resolve it at least. Either drink more water or take more fiber. Or if really cannot, from young to old, you poop only once or twice a week, right? You need to check with a doctor and see what we can do. Okay, so when you come and see urologists, what do? The most important thing I feel is to check the residual urine volume. Because remember just now we went through the overflow incontinence, right? We need to see whether you're retaining urine or not. Because retaining urine, all we need to resolve is stop it, then the incontinence stop. Okay, so when they come, we will check how much urine there's left over. Then we also do a flow test for them. Flow test is to check how fast your urine flow is. Is it good? Is it enough urine or not? Is it fast enough or not? Because for some of the elderly gentlemen, right, their pee really very slow. They stand in the toilet for the longest. So from all these flow tests, we can tell. Objectively, we can tell, but sometimes to the patient, they don't feel it's bad. But sometimes when we look at it, we tell them it's quite bad. Then we do urine tests. We make sure you don't have UTI, urinary tract infection. For the ladies, we will check whether you have any organ prolapse or not. Organ prolapse means that your organs are actually dropping out from the vagina. So what can drop out from the vagina, right? Your uterus can drop out. The bladder can drop out. Then the navel rectum can also drop out. Some people all drop out. Okay, that's bad, which means that basically you're not holding anything up. It's because the whole pelvic floor all very loose already. The tissue not holding up anymore. So when all these organs drop out, it actually causes a lot of issues. So we may need to fix it. Okay? Then usually they come to urologists, will do ultrasound, make sure that the kidneys are good. Okay? Sometimes got blood in the urine. Then we will do a scope for them to make sure there are no tumors anywhere. Then bladder diary. Bladder diary is difficult to do, but this is what you see. Basically, the patients have to chart 3 days how much they drink and how much they pee out for us. Then we can tell your pattern from there and see whether there's any issues we can correct from there, and whether I can get more information about your bladder from there. Okay, then this is my clinic. So basically, we got all these machines. Sometimes for patients who leak very badly and we don't know really what's the reason, right? We need to do tests for them. We need to put tubes inside the bladder and the rectum, and then we generate a chart to see whether the bladder okay or not. Oh, okay. Okay, so for stress incontinence, right, it can be graded. Okay, the most mild one, right, is when you once in a while cough and sneeze, you leak. Moderate one is you run and exercise, you leak already. The grade 3 is the worst. You move, also leak. So it depends on how bad it is. Then the treatment varies. Okay, so we run through the treatment. Okay, treatment-wise, right, what we can do generally, okay, to help everybody. One, bladder training. Bladder training means sometimes we ask the patient, every time you feel the urge a bit, don't go immediately. You tahan a little bit more so that your bladder can stretch a bit more. It's very important that your bladder can hold well. Why? Because if you can hold well, at night you can sleep better. If your bladder capacity is only like 150, 200, every time you reach 200, your bladder will, hello, wake up, time to go toilet. Then in the middle of the night, you have to drag yourself out to go toilet. And for the elderly, we try to reduce it so that they don't at least don't fall down when they go toilet, because I think that's the highest risk. In the middle of the night, you're half asleep, the light's not very bright or what, then fall down, then got fracture. Then everything goes downhill from there, so not so good. So you need to at least have a good bladder capacity. Even for kids, For kids also, sometimes I tell them you need to have good bladder capacity. If not, they'll wet their bed at night. Same thing, same logic. So what is a good bladder capacity? If you measure with a measuring jug, right, 300 to 500 is very good already. Then for the taller guys, like the Angmoh, or some guys are really tall, and they can hold up to 600, 700 normally. So it's good. But you cannot hold too much also. You cannot hold like 1 liter. If you can hold 1 liter and no sensation, there is a problem already. That means that your bladder got no sensation. No, that one is another thing altogether. That's bad. Okay? So it's just nice. Must be just nice. Pelvic floor exercise. Usually we will teach the patients how to exercise their pelvic floor. Those muscles can be controlled. Your bladder by right cannot be controlled because it's automated. Your bladder is automated. Once it's full, they'll tell you, hey, go pee, then you go pee, right? But this one very hard to train, but you can just slowly distend it that way, you see. But pelvic floor is something like our muscles. You go to the gym, you train, right? The pelvic floor muscle is the same. You need to do some exercises. It's not easy. It's very hard to understand. Most patients cannot get it right. We have to teach them specifically which one to contract. People contract wrongly. Contract tummy, contract buttock, contract thigh, everything. Then you see the pictures that we give, the pamphlet, right? It's always like doing Pilates. That's also not right. That's your core muscle. That's not the pelvic floor muscle. So that's why it's so difficult to tell people how to do it properly. Okay, for those people with urgency, a lot of urgency, right? And leakage, when you feel urgent, you need to go. After testing, after checking, right, usually we give some form of medications so that they can tahan better. It actually helps them in their daily life. For females, right, after menopause, I will give them a bit of topical estrogen. It's a hormone cream or hormone passive put inside the vagina so that the private part less dry. Less dry, the tissue thicker. Later I'll show pictures. The tissue thicker, then can hold better. Okay? Then stimulation. Okay, some places they actually offer this. It's like a chair. Not this, it's not the one. Another chair. So the chair can actually help you exercise the pelvic floor muscle if you cannot do it. So you have to pay money for it. If you can do it properly, right, usually it's free. You just do exercise like at home, sitting down, or got free time, then do. Then, unfortunately, right, some people, the very, very old patients, they really can't. So we have to teach them to use pads and diapers. If the urine cannot come out at all, meaning that the bladder is already kaput already, cannot, they have to put catheter. Or the guys, the prostate very big, not fit for surgery. We need to drain the urine out somehow. Then we need to put in a rubber tube for them to pee. Okay, then some people ask, if all these fail, the medications don't work for the urge incontinence, what do we do? Then we have to inject Botox or we have to do PTNS. This is really the third line treatment really for patients. If you all know anybody. Basically, if medication don't work for the overactive bladder, or still very urgent, or side effects from medication, then we have to do things like something like acupuncture, except that it's Angmoh acupuncture. The Chinese one, many needles. The Angmoh one, only 1 needle. Then we stimulate the nerve. Because the nerve here will stimulate the spinal nerve. Hopefully, we regulate the bladder back to normal. Okay? Then Botox injection, the Botox that we inject our face, right? We can also inject other parts of the body. It actually inject inside the bladder, it relaxes the bladder so that they don't anyhow leak. These are the different forms of treatments that we have. Okay, stress incontinence. What do we do? The pelvic floor, no strength. Number one, do exercises, as what we discussed just now. You can try to sit on those chairs and pay money and then, passively exercise for you lah. Okay. Then of course the newer treatment are laser treatment. Laser treatment is a procedure whereby I put a tube inside the vagina, then I use laser to make it thicker. Your tissue will be thicker lah. So this is on the right. You see, right? Is after menopause. Your tissue very thin. No choice. It is what it is because we lack hormone after menopause. Then either you apply the topical estrogen or you do laser treatment. It's at least thicker. When it's thicker, it holds better. That's what I always tell patients. Okay? Then it's minimally invasive. There's no downtime. Okay? You feel a bit of warmth during the procedure. Of course, compared to surgery, it's not as optimal. After I show you the surgery, what it looks like. Okay? So this is for people who are so scared of surgery. We do this kind of treatment for them. Of course, this is not permanent because once we do already, right, after a while the tissue continue degenerating. That one we can't help. So may need repeated procedure. But if it works well, we just wait for the next wave to come. Okay? And those people who leak, these are for people who leak minimally or moderately only. If you leak very badly, like all the gush, urine just gush out, cannot control at all, then we can't do that anymore. We have to do surgery. So basically, surgery is a bit different from what we saw just now for laser. Surgery is physically, we hold up everything. We try lah. Okay, as it continue to deteriorate, right, we just physically hold it up for patients. So what we can do is, you see, look at this picture, right? I explained to you. This is the traditional method in the past. Okay, it's a laparoscopic surgery. We actually put stitches right near the bladder to hold it up. So it restores anatomy. Okay, then this is we can inject something inside the urethra and the sphincter to make it close better. Okay, this one is the one we do most commonly now. We actually put a tape. It's actually a very thin, like soft plastic tube. We actually lift up the urethra from the vagina. So the operation is done through the vagina, so there's no scar on the body. Patient recover very fast because of that. So we actually actively lift up the urethra so that we kink it a bit, so that when you cough and sneeze, the pressure is distributed a bit better, so it doesn't leak so badly. Okay? This is the one that we do most commonly. These two not so common nowadays. Okay? Because this one is more invasive, and this one, right, the outcome is not as good as this. For this operation, right, what we call mid-urethra sling surgery, okay, usually the success rate is almost about 80% to 90%. Okay, for injection of this bulking agent, right, at best is about 30 to 50%. And for this one, it's also very good. It's up to 80 plus to 90 plus %. So these two are the better ones. This one is only for patients who cannot do any other methods. Okay, then what about the urge incontinence group of people? Usually, right, we have never gotten here for the patients. Some patients, because the bladder is very small, because of all other various reasons, they really cannot hold the urine, right? The worst case scenario, we take a piece of bladder, right? Take a piece of intestine, and then we paste onto the bladder, so to make the capacity better for them. This is like physically helping already. This one, so far, I've never really had any patients who had to do this. Fortunately, 90% of patients do well with medication or third-line treatment. Seldom need to do surgery for urge incontinence, okay? So, of course, a lot of people ask, what happens if you've got mixed symptoms? I cannot hold, I still urgent, then how? So basically, right, we need to run tests first, is what I showed you just now. We do a urodynamic study to show which is the worst problem. Usually, everything helps a bit, right, when they do pelvic floor exercise and bladder training. And then usually I treat the main problem. Urgency worse or stress worse? Treat the more severe one first, then I think the other one will get a bit better also. Okay? Then of course for the females, right, we want to make sure there's no organ prolapse. Because sometimes after we settle the organ prolapse, right, the incontinence gets worse. Because now everything back to normal already, right? The thing opens up already, then they will leak. So that's why we need to do proper tests before we offer surgery for patients. So this is for incontinence. Okay, now we move on to another one that bugs us a lot also, nocturia. Okay, nocturia, what is nocturia? Nocturia, right, is a condition whereby people wake up more than once to pee during their main sleep pattern. And then must be before and after they still continue sleeping. So if you got insomnia and you decide to go and pee, it's not nocturia, okay? That's insomnia. Cannot sleep, nothing to do, watch TV, go pee, it's not counted. Must be you fall asleep already, then your bladder disturb you or you wake up, you know, that kind of thing. Yeah, then you go toilet to pee. Pee already, after that must go back to sleep. Then counted. Okay? So you do it many, many times, you can just imagine it'll be quite bad. You really cannot sleep, you know. After a while, then you're tired in the morning. Not good. It can affect our sleep and health for sure. Okay? So if it disturbs you, right, please get it diagnosed and treated because it's potentially very treatable. Okay, don't suffer. Like, got people wake up 8 times, no need to sleep already, you know. Okay? Okay, the thing is that it affects both genders, you know. Of course, as we get older, it becomes more common. Okay, so the data is that more than half of those more than 50 years old get out to pee at least once. Okay, then it's related to my previous topic, you know. It can be associated with many things. It's not only a bladder problem. It can be overactive bladder. For the guys, it can be the prostate causing the issues. Why we have to get it treated is for a very simple reason. Because if you don't settle it, right, sometimes you get out to pee like 8 times, right, the chance of you falling down is times 8, no? That's the risk of it. Okay? Then sometimes, you know, elderly, you don't want them to have head injury and fractures because the quality of life after that really fall all the way to the bottom already. Okay? And it can cause by neurological and non-neurological conditions. After that, we'll discuss this. Okay? So also, right, we need to treat it so that you don't get into worse problem, no? Like heart failure and ENT issues, ear, nose, throat problem like sleep apnea. Okay. Yeah. So the impact, we summarize it nicely. 1 in 3 people age 30 and above, and 2 out of 3 age 65 and above have this nocturia. Okay, then it disturbs people, the sleep, blah blah. Okay, poor quality of sleep, increase of risk and injury. And then up to this, when you're very tired, right, you don't sleep properly, right, it's risky, you know. You can get road accidents and stuff like that. So make sure that, you know, and then they found that if you don't sleep well, right, your mental state is so bad, right, it's at least as dangerous as low-level alcohol intoxication. No? It's like permanently drunk. So don't do that. Okay, so this one I know is a very lengthy slide, but I'll just explain to you. What is nocturnal polyuria? It's a bit different, you know. Nocturnal polyuria means at night you pee more than daytime. Which, you know, when you're young, right, you pee more in the daytime, at night you seldom get out to pee, if any once. And usually daytime, much more urine. Nighttime, right, not much urine. But as you get older, it reverses, you know. It becomes nighttime, right, you wake up more or you pee more, as in volume-wise, there's more. Why? Because there's a hormone that we produce in the body that regulates this. As you get older, right, the hormone get a bit wonky already. So there's an issue with it. Then it becomes at night, right, you pee out more. So when you pee out more, this is the thing that you need to watch out for. Which means that nighttime output is greater than 20% when you're a bit younger, right? It is more than 20%, and when you're a bit older, it's more than 33%, 1/3. So by right, you shouldn't pee out more than 1/3 of your whole daily voided volume, right, in the night. Some people, we do, that's why we need the bladder diary. The bladder diary can tell us, sometimes I see, I was like, the patient pee out half in the daytime and half at night. So you know there's an issue already. Yep. Okay, so what to do when you have nocturia? You need to, what are the causes, common causes? Too much urine. Just now what we say already, nocturnal polyuria. Your capacity no good. How I described to you just now. Your bladder is either obstructed by the prostate or it's totally weak. There are patients with weak bladder. Usually the weak bladder, the female is more common. Weak means that they cannot push all the urine out. They are underactive. You don't want that also because you retain urine. Okay? Then, and then a lot of guys, right, a lot of men, they believe that it's caused by enlarged prostate. But sometimes it's not, no. Sometimes the urine production is really a lot. When you check the prostate, it's not as big. Yeah. So one of the first few things that you can do to make yourself healthy, right, is to don't drink so much alcohol and caffeinated drinks. Caffeinated drink also means Chinese tea, green tea, Coca-Cola, then our favorite coffee and tea, all this. A lot of people don't know, no. There are people who drink tea the whole day. They just boil one jug, then they drink the whole day. Then they don't drink water. Then they get older, then they, why like that? Then they get more urgent. Then tell them to stop also very difficult because they've been doing it for the last 30, 40 years. So I think safest is to drink water. You want to drink fruit juice, you've got no diabetes, I think that's fine. Coffee and tea, you want to go out with your friend and drink, then please carry on. Just drink. But don't drink the whole day like that because it's bad. Okay? Then before bedtime, don't eat or drink anything already. Don't supper is bad, law. Okay? You drink supper and drink Chinese tea, even worse. So you whole night you cannot sleep properly. Another thing also, as you get older, I suggest you don't drink coffee and tea after 2 p.m. So after lunch, don't take coffee and tea anymore. Because at night you sure cannot sleep. Somehow it just disturbs people. Then do drink water in the daytime. Drink adequate amount. So ballpark figure, what is enough, right? I think for most Singaporean, our size, right, 1.5 to 2 liters very good already. A lot of people don't even drink 1 liter. I think you need to change our habits a bit. Okay? So what to expect when you come and see us? We will check the tummy for everybody, the prostate for the guys. And then the females, I need to check the private part also. I think it's best. Then sometimes I give a bladder diary to do. Okay? Then for the males, I will also check certain blood tests at PSA. PSA is prostate-specific antigen. You all go health screening, you all see. One page will be called tumor markers. In the guys, there's such a thing called PSA, prostate-specific antigen. It's to check for prostate cancer. If it's abnormal, right, then you need to see a urologist to rule out prostate cancer. Then do urine tests, like something like what some of you all did just now. What you all did just now was very simple. That one is just a dipstick. The more complex one, we'll send to the lab to test. They're more accurate. Yeah. And then, of course, if there's blood in the urine or some whatever abnormalities we find, we might need to do a cystoscopy, a bladder scope for you to see whether there's any issues or not. Okay? So the fluid, yes, just what I said just now. If you have kidney stones, all this, you need to drink a bit more, 2 to 3 liters. But not everybody can do it. As we get older, we get heart problem, kidney problems, right? We cannot drink so much. If not, our legs will swell, then we get out of breath. Also, we'll run through the causes for nocturia. Okay, so the treatment. So you know that you're peeing a lot at night. So what is the problem? What is the cause? Okay, nocturnal polyuria means that, right, a lot of urine coming out at night, right? We must make sure that all these problems to be excluded before we can treat properly. One, you need to go and see your ENT surgeon, okay, your ear, nose, and throat. Because some of them, right, got obstructive sleep apnea. Obstructive sleep apnea means you snore a lot at night, Usually, the patient doesn't know. It's a partner who knows. Okay? Because they sleep, suddenly they and then they stop breathing. The one is obstructive sleep apnea. Then they'll get better as they turn, Because they turn, maybe the tongue fall away, then they then breathe again. Or if you get multiple times of this at night, right, it's not good for health. Okay? So the treatment for obstructive sleep apnea, number one, you must go and see the ENT and do a sleep study. After that, they will see what's the issue, got blocking or not, got any surgery to do, to put a CPAP. CPAP is a mask that opens up the airway. They sleep better, but it's very noisy. So not many people can comply with this. I think a lot of people don't know. Most of the time, after they see us or ask them, do you all snore? The answer is usually yes. Okay, so we need to sort this out. Simple method of making sure you don't get this problem is to not gain weight so much. Because gain weight, as you get older, also the tissue here become thicker. Then cannot sleep. Then got this obstructive sleep apnea risk. Okay? Then we also make sure that it's not heart failure. If people find that they're very chuan, they're very out of breath, very easily, right, then we have to check the heart already. Not so good. Diabetes, insipidus. Some people, diabetic, they don't know. Okay, that's the difference. The one that we see very commonly is mellitus, meaning that the sugar too much. Insipidus just means that they lose a lot of water. It's a different thing. But diabetes mellitus is what we all have, the most common one. So a lot of people don't know they got diabetes, no? Then they tell me they wake up many times at night. Then they pee, then they lick. Then I was like, this is weird. So when I checked, they're actually diabetic. Once we sort out the diabetes, they're okay already. Okay? Then, if all excluded, the patient don't have all these, right? Then we can give them a bit of hormone medication, to try to push the water back to the daytime. But it's not suitable for everybody. The very old patient cannot. Those with kidney and heart condition all cannot. Okay? This medication basically push the water to daytime. Try to go back to the state where you're a bit younger, when you pee out more water at night. So at night you don't keep waking up. Okay? But this medication is not for everybody, and also people have to be committed. Because taking this medication means that they have to check the blood sodium level, blood test. Okay? Because it drops the blood levels, especially for the elderly, then it's dangerous. And also be prepared to see other specialists. Sometimes I see already, I'll send to my colleagues to check, especially the ENT. Okay, fluid indiscretion. Some people drink a lot of fluid before bedtime because they're thirsty or they sleep in air-conditioned room. So try not to drink too much water before bedtime. Okay, then one thing you can do, don't drink caffeine after 2 p.m. Then lift up the legs. As you watch TV, right, maybe you should lift up your legs with a pillow or cushion. Then the water go back towards the heart, then you go and pee out before you sleep. I think that's the easiest. If you're going to stay in air-conditioned room, please wear socks. Then not so cold, don't kacau your wake up to pee. Okay, all these are simple things that we can do so that we can sleep better. Okay, then some people, right, a lot of patients, these are usually for the very much older patient, they are on diuretics. What is diuretic? Diuretic is a medication to push water out from your body, Okay, usually it's for the heart failure patient or the kidney failure patient. Their system got problems, so they have a lot of retention of water in the body. We need to push it out for them. If not, they'll have leg swelling, they'll be out of breath. So a lot of people don't know that all this medication basically, right, will cause you to pee more. It is what it is. It causes you to pee out all the urine so that you're not so out of breath. Okay, so when you are expected to pee a lot, your urine will come out a lot. Okay, and there's no way, right, we can stop all this. Or we can't stop the medication because it's for the patient's good. If not, they really will retain water, then they'll get admitted to hospital. Then we have to give them injection to push the water out. So what we can do is, most of the time, we are not the one giving this medication. Usually the kidney doctors and the heart doctors. So we may need to have a discussion with them on when best to take the medication. Okay? So this is something that I feel that can't be helped. Okay, overactive bladder is what we went through just now. Okay, in the fun part about the incontinence. So usually we'll treat the OAB, then the patients do get better. Okay, prostate. Prostate is a problem for the guys. Okay, females don't have. So people always ask, what is the prostate for? Usually it's quite useless. It's useless and it give you problem when you're old. Okay, when you're young, for the young men, I feel we cannot feel the prostate one. No. It's very, very small. No. As you get older, it get bigger and bigger from walnut to tangerine. Then it got a problem with it, right? So what does it do? When you're young, right, it produces a bit of semen fluid. Then when you're old, nothing very much except to go bigger and give people problem. Yeah. Okay, so that's about it. Then you can see from the picture, right? When you're young, right, not so big, usually smaller. The flow is very good because it's open big. Or when you get older, this whole thing just constrict. Okay, then your bladder will start acting up because you try to overcome the obstruction. Then after that, your bladder also screw up. So the whole system got problem. Finally, it accumulated and you cannot pee. Then we have to put in a catheter, all this. So usually, if you're not so bad, right, at the beginning, we can give a bit of medication to relax the muscles here at the bladder neck and at the prostate so that the patient can pee properly. Then another type of medication, we shrink the prostate. Okay, but shrink also cannot go back to young man state. Forget it. You can shrink at best 20 to 30%. Okay, if your prostate is already 120 grams, you shrink 20 and 30% is still quite substantial amount. Okay, we measure the size. Usually ultrasound we know, MRI we know. During surgery, we also take the tissue we measure also. So if it's so big, right, we need to seek some form of treatment. Okay, so it's not possible to go back to your young days. Yeah, that's all we tell patient. Okay, then all else fail, medication don't work, or you got complications already. For example, blood in the urine, cannot pass urine. Men having UTI, urinary tract infection, sometimes got bladder stone, sometimes kidney got problem. Why? Because your prostate is so big, right? It actually blocks the urine from coming out at the top. Usually there are two tubes coming out from here, leading to the kidneys. Okay, that's where the urine squirt out from. If it's so big, it actually blocks these two tubes. The kidneys are affected. So there are patients who come in with acute renal failure because of the prostate. Not common, but it can happen. So don't get there. Because otherwise, right, it's a very painful process for the patients. Okay. Underactive bladder. This one usually are not so well diagnosed. Means that the muscles, right, are not so good anymore. Usually it comes with age. But I also see young people with it, maybe inherent or what, we don't know. Most of the time, we need to make sure they don't have spine issues or this. So your muscle weak means that you cannot push all the urine out at one shot. When you go toilet, right, it's actually called a cycle. Basically, I just briefly described to you. When you go toilet, right, it's where your bladder call, hey, I need to go toilet. Then you go toilet, you put on your pants, it's good time for you to pee, right? Then you just sit down, or the guy just stand up. Then you will relax the pelvic floor. Then the bladder muscle will one shot push. All your urine will come out. And then after that, your pelvic muscle contract again. Then end the whole cycle. Okay, ideally, the cycle, right, when you're young, should finish in 20 seconds. If you find that, 1 minute is still there, right, then there's an issue already. Okay, so when your bladder is not working well, whether you're young or old, right, what do you have? The flow is slow. You need to push the urine out. Okay, longer time to finish. Sometimes you feel like, I still need to go again. After like, you finish already, walk out already, still have. Now, then you go and squeeze, always still have. Okay, always still have. You must also know that, right? It's very hard for you to have zero leftover urine. Only when you're very young can zero. But as you get older, there'll always be a little bit of leftover. If it's not very high, it's not too bad. But if it's like high, more than 100 and 150 like that, then it's problematic. So when you come and see us, we'll look at your urine, we'll know. Like you pee out 200 mils, your leftover is 150 mils, then you know there's an issue already. Half is left, Shouldn't. Okay? Can? Then, of course, underactive bladder sometimes can be other conditions like diabetes. So we need to screen for that also. Okay? Treatment, what is the underlying cause? We try to help. All in all, if your bladder, we exclude all issues, but your bladder doesn't decide to give up already, kaput already, then you have to drain your own urine. That's very unpleasant. We teach the patient or the caregiver how to drain their own urine. We put in a tube, then drain, then after that finish and take out. Okay? The worst case scenario is put in a catheter. Then you just carry a bag of urine everywhere you go. It's very uncomfortable for patient. Okay, diabetes, we went through it. I'm not the best in talking about diabetes. Okay, but I just want to tell you all, when you have diabetic, so diabetic until there's a lot of sugar floating in your body, right? You will draw the urine in, you will draw the water in the body, right, into the kidneys and into the urine. So that's why you pee a lot. So this is easily reversible. Once you treat the diabetes, you're all good. Another problem with diabetes is that it causes UTI. Some patients, they keep getting UTI. They don't know why. Basically, after I check, I realized, they actually got diabetes already. So after we treat the diabetes, they're also much better. Why? Because the diabetes actually affect your immune system also. So you're not so good at fighting infections. And also when you're diabetic, all the urine coming out, you feel very urgent all the time. So people keep taking UTI. Actually, it's not. It's just the body losing water. Okay? Other chronic condition, heart failure, liver, renal condition. Sometimes you can have nocturia. Okay? Because your body water balance not so good. Okay? So you need to see other specialists or this, or at least consult your family doctor when you have all these problems. Okay. So tips for healthy urinary system, what you need to do. Drink water. Okay? Then you go regular toileting. Don't hold back voiding. Some people are very busy. Usually the younger people. They're very busy. Then they keep telling me, oh, no time to go toilet. In time to come, your bladder will have problems. Because you hold and hold and hold, your bladder, right, lose sensation. Then next time, right, when you really need to go, you feel that you cannot pee, Because the bladder, how we describe it is like your bladder is like a rubber band. You don't want to stretch it until it has gone to a point of no return. You know your rubber band will stretch until very badly already, right? Before it picture, right? It will be this loose thing. You don't want your bladder to be like that. Yep. If you have urinary tract infections, treat it early. Don't let it fester on because it will lead to other issues. Okay? Leakage is not normal. Let us know so that we can try to help whatever we can. Healthy diet. Okay? Healthy diet is for everything. When you're healthy, everything works a bit better. Okay? Then do exercises and get some sunshine because I think everybody is vitamin D deficient in Singapore. So get some sunshine or else take the vitamin D supplement so that everything works better. Okay, then just now I know that some of you did the urine test. So the chart there, right, shows that you need to look at the color of the urine. A lot of people ask this question, what color is good? Very light yellow is good. Okay, you don't want it to be orangey, Orangey means that dehydrated already. Red, like your chair red, got problem already. Okay, you also not be very clear, like transparent, like that. Mineral water is very hard. You must drink a lot of water for it to be transparent. Okay, so just lightly yellow is good. Early in the morning, right, when your urine is a bit darker, it's normal. Because the whole night you're sleeping, right? When you're sleeping, your organs are not sleeping. When you're sleeping, the organs are actually working quite hard. So your urine will be concentrated in the morning. It is what it is. Because your kidneys, you don't drink water at night. Your kidneys is just concentrating. So the first urine is usually very yellow. Okay? If your first urine is not yellow, then you should be a bit concerned. If it's very white, if it's very transparent, there's some issue already. Your body is losing water. Okay? If it's very red, at any point in time, then there's an issue. You got blood. Okay? Then when you have discomfort during urination, there's some issues. For example, burning sensation, or hair pain, or cannot come out, the penis pain, all got problem. Okay? Then sort it out early, because most of the time after that, you're all good already. Then, okay, let's talk a bit about just now that dipstick test. The dipstick test, right, there's many components in it. Basically, it's just to show your Okay, if you see any abnormalities in the dipstick test, for example, leukocyte positive, it's called LUE, leuc, or nitrite positive, or got blood, right? Then what you all need to do, because today's test is just to show you all. So basically, if there's some abnormalities, please do go and see your family physician, all these to a repeat test. Okay, because you need to have a very good specimen to tell you whether it's normal or abnormal. The dipstick is a very good test. Let's say, example, you think you got UTI, or you very pain, then you go and do a dipstick. Usually the GPs do it. So you will see leukocyte nitrite positive, then they will treat you. But when you come and see the urologist, usually we will send it to the lab. No? We'll send a proper urine culture and microscopic one. That one can tell us a bit better, because I need to know which bacteria it is also. And how you collect the specimen also make a difference, you know. Some people don't give us a midstream. Some people don't clean a bit before they pee. Then they end up all very contaminated. Okay, so just now those who did the dipstick, just take a look. If it's normal, congratulations, very good. Okay, if it's normal, it's really quite normal. Okay, but if it's a bit abnormal, you need to go and repeat it. Okay, can. I'm happy to take any questions now. Okay, if often spray water to help poop, will that harm or affect the bladder wall or cause urinary issues? Okay, so if you need to stimulate yourself to pee and poop, there are some issues already. Because I think inherently, right, your system doesn't work so well. By right, you should just relax your pelvic floor, your poop and pee will come out. Yeah. But if you need to spray and then stimulate your tummy or your private part, somewhere near there to poop and pee, right, there's some issues. Yeah. It will not cause harm, but you need to get it checked out why you have to do that. I'm male and tend to urinate frequently during 4 to 6 p.m. daily. Is this okay? Okay lah. Your frequently, it depends on how frequent it is. If you pee at any time, every 15 minutes you need to go, right? Then there's an issue. Theoretically, if you drink 1.5 to 2 liters a day, right, and you're quite normal capacity, right, you can go toilet every 2-3 hours. It's quite comfortable. That's how I tell my patients. If you go toilet and you pee out 300 to 500 each time, you're very good. It's quite good already. It's just how much water you drink. You just need to control your intake. Okay? But if you pee like half an hour cannot already, then you really have to see one of us. Do we wee out all the water that we drink? The answer is no. Because we have insensible laws. When you sweat, you will lose water. When you poop, you will lose water. Or this, when you breathe, you also lose water. So the balance will never be just nice. You drink 1.5, you pee 1.5. It's not possible. There are some differences, so don't worry about it. Does Kegel exercise help to shrink prostate? No. The only way not to, the only way, right, the prostate is no choice. Okay, there are some genetic predisposition. For example, some families, they got more prostate cancer. For some people, right, more people got prostate issue in that family. Okay, then Asians, to tell you something, Asian not so bad. The Angmoh is very bad. The Angmoh, the prostate really very big when they're young already. Asian not so bad. Yeah. Okay. No lah, it's peeing once at like 3:30 a.m. a concern. No, just once, okay. No more than that, okay already. Yeah. Pee how many times at night? Sleep is considered abnormal. Anything more than twice 2 and above is abnormal. So 0 to 1 still okay. Yeah. So the thing is that the first thing I think you need to do is to control the water intake. Or do all your lifestyle changes to make it better. Okay, why bladder full, lower back got pain? Sometimes like pause a bit, then can pee. That means your bladder is too full already. If your bladder is so full until you feel pain, then please go toilet faster. No? Because I think inherently, if you're not careful, right, you can get reflux all this. Reflux means that the urine cannot come out, right? It actually goes up to the kidney bag, so that one no good. So don't wait until last minute and pee. Okay, as a ballpark, right, basically you wait until 90% full, then you go toilet already. Please don't be 110% full, because it's not good. Yeah. Okay? Okay, if every time after urination the penis tip always itchy, why? Then you check your urine. Maybe it's a bit of infection. The other reason, right, for the guys, right, is sexually transmitted disease. So make sure that it's not these two. Okay? Pee with smell, is it diabetic or means what? Pee with smell means that under one, either you got urinary tract infection or you don't drink enough water. Okay? If it's smelly, first pee of the day will be a bit smelly because it's very concentrated. Subsequently, please, if it smells abnormal, please ask us already. Okay? Especially if you come with some penis itch or pain, then come and see us. No pain. Can? Okay, do one last one.
Okay.
Can? This one, I have surgery for prostate enlargement. After 18 months, still got incontinence. How to treat it on medication? Yeah, this one, right, you need to do a proper test for it. We need to do either a scope or UDS to see what's the issue. Okay, or else is to do pelvic floor exercise. You have to see a proper physio to do it. Because for the guys, right, it's a bit difficult for you to understand. Yeah, okay.
All right, and once again,
answer as many as I can.
Yes, you did, and thank you. That was Dr. Fiona Wu.